Hello and welcome to the Saturday, April 25th edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith and I am here as always with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, what is our situation today?
Well, Tracie, the sun is shining, the weather is warming up, but it's still not the time to relax our restrictions. It's still very, very important to keep your physical distancing and staying at home. But staying at home means you still need to go out as long as you maintain your physical distancing for short, brief walks, because your physical fitness is still very important. But you do not go out in crowds, and you keep your physical distancing. And remember, the regulations are still 5 people or under, as long as you keep on your physical distancing. So we're making some good progress here. We're a bit worried about the good weather coming and people not being able to adhere to those public health restrictions, but it's still very important. As of today, we have continue to have just 2 cases of COVID-19 in the hospital. We have 20 presumptive cases, and certainly that has been stable for the past couple days. We have 62 confirmed cases in our area, but the good news there is we have 46 of these confirmed cases resolved. So all in all, I think we're making some very good progress.
Yes, the numbers aren't climbing quickly, but there are new cases, it seems, announced every few days, and a really important reminder to stay the course. And that leads to my next question, the screening at hospital entrances. We expect that that's going to continue for weeks, if not months, to come. How are things progressing in terms of screening at our hospital entrances?
Well, the hospital is a different place as it was 6 weeks ago. I mean, it's a whole different look. The hallways are empty, but at each entrance you have these stations where you go through a screening procedure, and this is all to protect our healthcare workers and our patients from not bringing in a COVID-19 patient to the hospital. Because once an outbreak occurs, it's difficult to recover from that outbreak. So everything is sort of in place to prevent COVID-19 coming into this hospital from a potential carrier. So we've had staff. I mean, this is an expensive venture. I mean, when I talk to my chief of operations, it takes 40 full-time people to man these stations, and that's a large redeployment of our staff. We have the luxury right now that our hospital is only 6% occupancy, so we can redeploy staff to take on these stations. But as we begin to increase our level of services, we could be faced with human resources challenges. So we're trying to put procedures in place that will help replace this workforce at screening. And we've been lucky enough to be in contact with the federal government, both Dr. Marcus Plowski as well as Patty Harju, regarding student opportunities over the summer months to help fill some of these positions. And we're looking at other types of innovative ways to support the screening activities that I think is going to be in place for, if not months, it could be into a year or so, because we want to prevent any infection coming into the hospital, and this is a good first step, screen before people come in. So we're making some progress, but we have a fair bit of ways to go because it's an expensive venture to man these stations. But everybody's doing such a good job. They're always positive when you come in. They got a smile on their face, and it's nice to see. They also have a mask on their face, too, so you don't see the smile all the time.
It is a really important role, and I'm glad to hear that it is going to be continued. What are some of the other precautions in place, particularly for staff and professional staff, some of them at risk more than others for exposure to COVID-19? What have we put in place?
Yes, Tracie. I mean, working in the hospital environment, working in healthcare facilities, long-term care facilities, hospitals, retirement homes, we're all at risk, and we all know we're at risk. But that's the reason we stepped into this profession, to make sure we are there to take care of the healthcare needs of the population. But some have an increased risk who work on the COVID COVID-19 unit, who also are in the intensive care unit, who also are in the emergency department. And there's sometimes unknown exposure to individuals who may have COVID-19 or turn to be COVID-19 while in hospital. So we're actually, and we want to protect our healthcare workers best we can with the proper PPE, but sometimes there's some unexpected occurrences. And sometimes we need to protect our healthcare worker and their family. So if they have an unknown exposure to a COVID-19 patient or a high-risk patient, we certainly want to provide accommodations for them if they're unable to go home and self-isolate, or if they have a person in their home who is immunocompromised. So we are working on some paid accommodation for those individuals who actually meet the occupational guidelines, and because we want to make sure we take care of our staff and the family that our staff is associated with.
That's another really important measure. There are a number of supports in place for staff, and it makes me feel good as an employee of the hospital.
Yes.
Speaking of employees of the hospital, a very critical group here in our hospital, medical laboratory professionals, and we just celebrated Medical Laboratory Professionals Week. What would you have to say to our professionals here?
Yes, I went down and had a visit with some of them yesterday, and I didn't participate in the Persians, but there were certainly Thunder Bay's Persians that are available for our sort of staff down at the medical lab, and they are really another group that are unsung heroes. I mean, they actually are able to do this in-house testing for COVID-19 and other infections. They are responsible for the blood that we receive and get every day, and trying to preserve the blood we have. They are sort of the individuals who's the science behind the investigations that physicians and nurses have. So I mean, it's just an amazing group. It's led by Georgia Carr, who's an outstanding leader. Lots of enthusiasm, and they protect us from infectious disease. It's just not COVID-19. There's many, many other sort of unknown, hidden biological hazards out there that certainly can create havoc within a hospital. And the timely turnaround, the dedication they have to their work is just outstanding, actually. So I'd like to say, they're doing an absolutely great job. It's an annual celebration. They all seem to be sort of excited to contribute to this adventure, and certainly there's more than a venture to this COVID-19 strategy, and they are key partners in protecting all of us.
Yeah. Well-deserved recognition to that group of professionals. Now, moving on to the recovery team. So work is ramping up in that area. They've developed some tools to collect information that will inform how we begin to introduce clinical services that have been paused because of COVID-19. What sort of things need to be considered in those decisions?
Wow, this is going to be I think, our most difficult task, when to begin to escalate medical services so we make sure we take care of non-COVID patients out there who are going through pain and suffering in our community. And we really need to begin to increase our volume of services to make sure the health status of individuals in Thunder Bay is addressed, because it's concerning to have the pain and suffering going on with our patients out there, and we're unable to address in a timely fashion. But we're going to have a whole team of dedicated surgeons and administrators and nurses, sort of to educators, to look at how we begin in a calculated, priority-based sort of measures to make sure that we can reintroduce some services that are quite needed. And this is not financially driven at all. Our focus will be on the patient and the needs of the patients as we move our initiatives forward. So we're getting several reports back next week from our recovery team to look at the priority services we need to start to begin with. I think all hospitals throughout Ontario are looking at this right now. We don't have a playbook. This is new for all of us, and we still don't know the amount of asymptomatic carriers out in the community. So there is still risk involved, but I think there's a greater risk if we don't begin to move on, especially our priority services we require.
So we have some expertise at the table helping work through all of that, and we'll have some more information in the days and weeks to come.
Absolutely.
Great. Look forward to that. Thank you for joining us today. We'll see you again soon.